Good afternoon. In today's video demonstration, we're going to demonstrate the routine procedures of the foot, namely foot AP or AP axial projection, foot oblique or medial rotation, and foot lateral or mediolateral projection.
John.
Good afternoon, ma'am.
Turn, sir.
Um, ma'am, mag-ask ko ma'am sa inyong language preference.
Bisaya, sir.
Sige po, ma'am. Ma'am, tala ko ma'am for patient confirmatory identity. So, para ma-identify na ako kung ikaw ba yung right patient. Tala ko about sa inyong middle name, ma'am.
Okay po.
Age and birthday. Isa kayo middle name niyo, ma'am.
Older, sir.
Age,
Then, 17 years old po, sir. Then,
date
August.
of birth.
August 3, 2003 po.
Sige. Noted po, ma'am.
Okay, sir.
Ma'am, tala lang ko, ma'am. Ngano nagpa-x-ray ka, ma'am, sa inyong foot?
On, sir, kay natapit po ko, sir, ba? Opo, then,
Tapos?
nagsakit siya.
So, makayo ba nimo mama? Makalakaw gyud
Opo.
ko. Pwede na kayo sa sakit.
Dili po kayo, sir.
Sige na ito.
An?
Ma'am, gidugo ba ka karon, ma'am?
Katulad po last month.
So dili ka pregnant karon mo.
Dili po.
Sige. As na ko ma'am, asa dapit na affected side inyong gani ma'am foot? Asa right or left?
Sa left, sir.
Left. Sige na. So, nagpa-x-ray ka, ayun sa din doktor kay foot x-ray kay nakatagil po ka atong
Opo.
sige. So, before ta mag-proceed sa atong procedure, ma'am, i-instruct na kadaan, ma'am, na tanggalon na to atong mga metallic objects nila sa MTA, kung naboy mga sing-sing or ay niagi ba kag mga surgery last time, ma'am, nga gibutangan og stainless ilang tiil.
Wala, sir.
Okay, noted. Then, katulang ma'am, then maminaw to sa atong instruction, ma'am, ha, para madali lang ka.
Okay po, sir.
Ma'am, mag-introduce dito sa imo ha og ma'am, shielding. So kani ma'am, ano siya itong ginatawag nga gonadal shield. So ibutang nato ni siya diri ma'am sa imong gonads gid ma'am para ma-protektahan ang imong ovaries against the radiation kay sensitive na siya sa radiation. So mo ni ang ato ang shielding sa atong thyroid. Then butang nato ni siya sa imong liog para dili ma-expose ang imong thyroid kay sensitive na siya sa radiation.
Okay po, sir.
Sige. Pao tandaan, ma'am.
Okay.
Ano siya sa pagkaon, sir? Okay lang, ma'am. Gunit ko, sir, ha? Ay, ma'am. Then, di thyroid, ma'am. Ikaw na nabutang ani, ma'am, ha? Okay lang, ma'am.
Okay lang, sir.
Sige. First is, we will going to demonstrate the dorsoplantar AP foot projection. So, the technical factors that we will going to use is the NIR, which is 10 by 12 inches or 24 by 30 centimeter. Then, this procedure is non-grade, so we don't need to use a grade. And, this is our marker, lead marker. Since our patient kay left ang iyang affected side, so we need a lead marker na left. Then the SID will be 40 inches or 102 centimeter. Pasok na po, ma'am. So, ma'am, mag-ista ko, ma'am, ha, ma'am. Please lie down po, dili, ma'am. Dili mo ulo, ma'am. Paano ka, ma'am, touch ko? Then, shield lang, ma'am. Sige, naman ng center. Make sure that you align the patient MSP at the center of the table. Then, dorsiflex, move the unaffected side of the patient leg behind the affected side since left man siya, so. And instruct the patient to dorsiflex the feet of the patient, the left feet or foot of the patient. Ma'am, i-dorsiflex natin, ma'am, ha. Sakadan. Then, use um, the 10 by 12 IR. Place it on the foot, the affected foot. Then make sure that the long axis of the foot and the long axis of the IR is parallel to each other. And center it to the third base metatarsal of the patient. Make sure that you extend the foot of the patient or the plantar flex the foot of the patient by sliding the foot and IR distally while keeping the plantar surface flat on the IR. As you can see, that the plantar of the patient is flat on the IR. Then the central ray is perpendicular to the metatarsals, which is about 10 degrees posteriorly towards the heel, centered to the base of the third metatarsal. Then, so to demonstrate that, so we angulate the collimator, the tube, at 10 degrees towards the heel. Then, by the way, there are two central rays for this projection. The one is directly to the third metatarsal of the patient, third base of the metatarsal. Then the second one is the 10 degrees towards the heel, centered at the third base of metatarsal. So today, so we're going to use the 10 degrees centered at the third base of the metatarsal. Then collimate on 4 sides and make sure to include the long axis of the foot of the patient. Then do not forget to place the lead marker. Then instruct the patient that do not omit unnecessary movements. And make sure that in putting the lead marker, make sure that it does not superimpose with the anatomy of interest or obscure. Then instruct the patient to do not omit other unnecessary movements. So, ma'am, ayaw lihok, ma'am, ha. Then, shoot.
Go.
In the anatomy demonstrated in AP or AP axial projection, there should be an equal spacing between the second through fifth metatarsals. The joint spaces between the medial, first, and the intermediate or the second cuneiforms is demonstrated. About 1/3 of the talus is superimposing the calcaneus, or 0.75 inch or 2 cm of the calcaneus is seen without the talar superimposition. The navicular cuneiform joint spaces are open. The third metatarsal base is at the center of the exposure field. Then the proximal calcaneus, talar neck, tarsals, metatarsals, phalanges, and foot soft tissues are included within the exposure field. The next projection that we will going to demonstrate is the oblique position, the AP foot oblique position, specifically the medial rotation. So, as you can see, the patient position was positioned in supine position. Then, so from this position, instruct the patient to rotate the patient's foot medially. So, ma'am, i-rotate ito imong TL, ma'am, ha, medially. So, touch ko, ma'am, ha. So, make sure that the base that is rotate it about 30 to 40 degrees. Then, so the rotation, as you can see that the patient foot is rotated 30 degrees to 40 degrees medially. Then, note that if 30 degrees lateral oblique projection will be demonstrate the space between the first and the second metatarsals and between first and second cuneiforms are clearly seen. So in this position, the cassette that the technical factors that we're going to use is the same as the AP foot. So specifically, the IR will be 10 by 12 inches, then the SID would be 40 inches or 102 centimeter. The central ray must be perpendicular and centered to the base of the third metatarsal, then collimate on the four sides up to the skin margins and foot of the distal ankle. So to demonstrate the central ray, the central ray must be centered or perpendicular and centered to the base of the third metatarsal. So the base of the third metatarsal is here. So center the central ray. 1. Then do not forget to place the marker. And collimate. Then instruct the patient to do not omit unnecessary movement. Then shoot. The resultant image of the AP oblique foot is shown in this resultant radiograph. In anatomy demonstrated, the cuboid, cuneiform joint spaces and second to fifth intermetatarsal joints spaces are open. The tarsi sinus and the fifth metatarsal tuberosity are visualized. Third metatarsal base is at the center of the exposure field. The phalanges, the metatarsals, tarsals, calcaneus, and foot soft tissues are included within the exposure field. The next projection that we will going to demonstrate is the mediolateral of the patient, or the lateral projection of the foot. So the IR that we're going to use is 10 by 12 inches. Then position the patient. Since the patient affected side was the left foot, so instruct the patient to lean on the left side laterally. Ma'am, lean position ta ka ma'am pa left man, since left man imuhang kuan ma'am, no, so position ta ka ma'am na ma'am. Then dorsiflex the foot of the patient to ensure that so as you can see that the patient is on the recumbent position on the affected side. The knee flex with an affected leg behind to prevent over rotation. Then place support under the affected knee and leg as needed to place the plantar surface of the foot perpendicular to IR for true lateral position. So as you can see that the patient foot is in true lateral position. And for the central ray for this projection is perpendicular and centered to the area of the base of the third metatarsal. So to demonstrate, the third base of the metatarsal is here. Collimate. Then collimate on the four sides, skin margins of the foot and distal ankle. Then put the ledge marker Instruct the patient to do not omit unnecessary movements. Ma'am, ayog, lihok ma'am ha. And the SID for this one is 40 inches or 102 centimeter. Ma'am, ayog, lihok ma'am ha. Then, shoot. For lateral foot projection, the resultant image look like this. Then the anatomy demonstrated and the evaluation criteria are the following. Contrast and density are adequate to demonstrate the anterior patellar, pretalar and posterior pericapsular fat pads are clearly demonstrated. The long axis of the foot is positioned at 90-degree angle with the lower leg. The metatarsal heads are superimposed. The proximal aspect of the talar domes are aligned. The tibio-talar joint is open. The anterior and posterior aspect of the talar domes are aligned. Distal fibula is superimposed by the posterior half of the distal tibia. The distal tarsals are at the center of the exposure field, and the phalanges, metatarsals, tarsals, talus, calcaneus, and 1 inch or 2.5 centimeter of the distal lower leg and foot soft tissues are included within the exposure field. Ma'am, done na po atong procedure karon ma'am. And ang result dahil ma'am is 2 to 3 hours pa po bago niyo makuha ma'am. So, okay lang ba ma'am?
Okay lang po, sir.
Sige po ma'am. Ma'am, thank you kayo sa cooperation ma'am ha.
Okay, thank you po, sir.
Thank you.